Introduction to Oral and Maxillofacial Surgery. For any subject, whatever the subject be, let it be endodontics or MFS or anything, the first and foremost step is sterilization. Am I right? If not properly sterilized, it can cause harm for both the patient and doctor. So let's start with the sterilization first. You have studied sterilization, all this kind of sterilization aseptic techniques in microbiology in your second year classes. But as a revision, I will tell you, we have two kinds of sterilization. The first one is the physical method of sterilization, and the second thing is the chemical method of sterilization. In physical method of sterilization, you can have sunlight kind of sterilization, drying, heat. And in this heat, you have three subdivisions, which includes dry heat, moist heat, and oil. Okay. In dry heat kind of sterilization, you can have the common kind of flaming, red heat, incineration, then this hot air oven. These all comes under this dry heat kind of sterilization. This is not in exam point of view, okay? In exam point of view, you have to study moist heat sterilization. That's what I have included in the PPT. As you can see, autoclave is a usually commonly asked question in our examinations. Okay, usually it comes as autoclave or autoclaving. The question usually comes like that, 4-mark question or the short note question, it usually asks like that. Okay. Okay. So in moist heat sterilization, we have three subdivisions. One is the temperature less than 100 degrees Celsius, temperature at 100 degrees Celsius, and temperature above 100 degrees Celsius. For the temperature less than 100 degrees Celsius, the vaccine, bath, pasteurization of milk, this all comes under that. In 100 degrees Celsius, the usual boiling point of water, what we do in our home, in our kitchen, the usual boiling, it all comes under the 100 degrees Celsius kind of sterilization, tintalization, all this comes under 100 degrees Celsius. But above 100 degrees Celsius, here comes our hero, which is an autoclave. It is a very important and the most commonly used thing in dentistry. Not only dentistry, in medical and dentistry, we use autoclave. Okay, so just have a look at that PPT. It's a moist kind of sterilization. Temperature is above 100 degrees Celsius, as I said. So always note the point that the temperature that we use in autoclave is 121 degrees Celsius, and the pressure used is 15 psi. And we use this autoclave for 24 minutes. It can range from 24 minutes to 30 minutes. You just round and right 24 to 30 minutes, you put the instruments in autoclave. Okay, the basic principle of this autoclave is that you cover all your instruments in a green cloth or a paper bag or something like that, and you keep inside the autoclave, and you just close it and you on the autoclave. So what happens there is a direct steam that comes in contact with this instrument. There's a moist environment inside, there's water flowing inside, there's a moist environment, and this steam will come directly in contact with the instrument, and that will help in the sterilization process. So the basic principle is that each item is exposed to this direct steam at this required temperature, which is 121 degrees Celsius, and at the prescribed pressure, that is 15 lbs, for a specified time, which is 24 to 30 minutes. Do you get it?
Yes.
Okay. So the mode of action, when the steam meets the instrument to be sterilized, what happens is it releases a latent heat there. This latent heat will now go and act in the instrument, and it will denature the vital cell proteins of the microorganisms present on that instrument. We know this instrument will be completely covered with microorganisms, right? So these microorganisms will get killed due to this latent heat, which is released in this autoclave machine. And this condensed water or this moisture also provides a very good environment for killing bacteria. And we have a particular pressure inside, which is 15 lbs, and this pressure will also help in killing this bacteria. And this pressure can make this autoclave machine more hotter. And all this environment, the moisture, this pressure, this temperature, and this specified time actually helps in killing the bacteria and getting these instruments sterile. Are you able to follow me?
Yeah.
Okay, so let's see the okay. So the advantages are effectiveness, speed, then relative availability of autoclave, and disadvantages. The first thing, cost of autoclave is very high. Okay, and the second thing, this is a problem that I also face, because when we put an instrument like a scaler or a scaler tip inside the autoclave, the next day you can see a brown color of patch over this.
Yeah. Yeah.
It is rest. Resting is a very common thing that happens for the instruments that we place under autoclave.
Oh,
But whatever it is, we have to sterilize. So we keep it inside autoclave. But this is a very big disadvantage. So don't miss that point. Rusting is very commonly seen in autoclave.
okay. Okay.
Okay. So that's all about this kind of sterilization and all. This is the usually asked question, and we have chemical kind of sterilization also. That's not at all asked. Just for the point of knowing, just you just um, okay, I'll tell you, there are disinfectants, there are alcohols, the aldehyde compounds, the chlorines, these all are available for sterilization, but it is not commonly used in dentistry or medicine. We use all this kind for floor cleaning and all in our hospitals and all, that's it. But we don't want to study more about it. Just keep it in your mind that these all are also used for chemical methods. These is the physical method is something that we use at a doctor's point of view. You just want to know about it. Okay. Now we'll go to the principles of surgery. It's an 8-mark question or a short essay kind of question. So just look at that PPT. So the first point, which is the necessities of surgery, we have two necessities of surgery. The first one is adequate visibility, and the second one is assistance. Adequate visibility. Why do you want to have a very good visibility to the area of surgery? If you don't have visibility, it will be a big failure. You are doing a surgery, right? It can go for cutting any vital structures when you're doing a surgery. So you need a very good visibility to the area where you're doing the surgery, right? For that, you need an adequate access, you need adequate light, and the next one is adequate assistance, which is surgical field free of blood and fluid. You need a very good assistant to keep your suction tip and remove all the blood and other fluids in your fluids in the patient's mouth. Okay. For adequate access, you want the patient to open the mouth widely. Then you will go for creation of a surgical flap. You want to give a very long stroke and very long stroke with the help of blade, and you have to have a very good access to that area. Then you have to use an retractor, an Austin retractor or something like that, and you have to retract the soft tissues so that you do not harm any of the vital structures that are present near it. Okay, that is what is meant by adequate access. Then you need an adequate light. That's always present in all the clinics, right? We need an adequate light.
Yeah.
Then next is a surgical field. A surgical field should always be free of fluids. For that, we use a suction tip. When we do a surgery, we know that there will be a lot of blood, there will be saline, there will be betadine, there will be water. These all things will be flowing inside the patient's mouth. So we need an area which is clear of all this to perform a surgery. So you need a very good suction with good pressure to remove all this fluid. Okay. Now the aseptic technique. As I told, you had to do all the asepsis and all. You had to put the gloves. You had to do all the aseptic techniques. You had to sterilize all the area. You need a very good sterilized instruments. All these things you had to care of. Now we are coming to the surgical part. We are going to give an incision to the patient. Okay. For this incision, you have some principles to follow. You have to use a sharp blade of proper size. Don't use repeated blades and all. There are many clinics who use repeated things. They just autoclave and use it. Don't use like that. If you use it, it will not be very sharp. It will be having a blunt end and can cause very much damage to the patient. Okay, you should have a very sharp kind of blade. You need so that you will have a clean incision. So, and you don't go for repeated stroke. If you go for repeated stroke, what happens is it can damage the vital structures. Go for a single long stroke. Don't go for small strokes. Give a long stroke, which will expose a complete area you want to see. You want to do a surgery. Okay. So you do a firm continuous stroke when incising. Long strokes are better than short interrupted ones. Okay, then you have to be very careful while cutting because you should not cut a vital structure. There's lots of blood vessels and nerves that are present. Right. When you are doing, for example, you are doing an impacted third molar surgery, and if you go and cut the inferior alveolar nerve, what happens? The patient will be on paresthesia till the end of his life. So you have to be very careful while incising. You should not incise or touch any of the blood vessels and nerves. Then, when you give an incision through the epithelial surface, it should be made by holding the blade in a perpendicular position, like in a 90-degree angle. Don't use it like a pen. We write with a 45-degree or something like that angle, right? You should place the blade in a 90-degree
Perfect.
perpendicular angle to the epithelial surface so that you will get a squared wound edge. So if you get a squared wound edge, just imagine if you get a squared wound edge, when you try to suture it will rest very neatly,
Mm.
right?
Yeah.
You should not design anything as an incision. If you give a very good squared wound edge, when you place
Wounded.
it back, the suturing will be very neat and very
E.
okay. Then incisions through attached gingiva and healthy bone is more desirable than unattached gingiva and missing bone, because if you place this flap over and in a place where there is no bone or a bone injury, what happens is healing will not take place. Cause more and more damage to the patient. So
More than
whenever you place the flap back, you have to make sure that the underlying bone is healthy, intact bone.
health. Okay.
You get me?
Okay. Yeah.
Okay. Now, wound margin should be sutured over intact, healthy bone, at least a few millimeters away from the damaged bone. I mean, if you have a damaged bone and you have this flap over it, don't place it directly over this wounded bone. You have to place it somewhat covering the healthy bone also, so that the healing will be more better. This is a place where you have a damaged bone. Okay, if you have a good healthy bone present, don't place it over the healthy bone. It can damage the patient. Okay, now we are going straight to the flap design. This is a flap design. You can see in that picture. Okay, surgical flaps are used for what? To gain access to that area, or like to move tissue from one place to another. Like for grafting, you can use a surgical flap, or for access to an area also, you can use a surgical flap.
So,
Okay,
yeah.
so
Okay. Okay.
there are four basic flap designs present. Okay, four basic flap design principles. Okay, the first one, the apex of the flap should never be wider than the base unless a major artery is present. The
Okay.
apex of the
Yeah.
flap, this is, I'll show you.
Uh,
This is the base and this is apex. The apex
Apex.
should be never wider than the base.
Wide and
Always a base should be wider. And if
wide.
an artery, if a major artery or vein is present, do not go. That is a that you can
Okay.
avoid. Okay, until and
Okay.
unless a major artery is present, you have to make sure that the flap apex of the flap is wider than the sorry, not
Wide.
wider than the base.
Never
You
wide.
get it, right? Never wider
Yeah.
than the
Yeah.
base.
Yeah.
Next one. So you compare now. You compare the width of the base and the apex, and then next we will compare the length and width. Okay, that is, you just remember this formula: x is equal to 2y. Okay, just remember, always write also flap diameter is equal to 2y. Then just have a look at this. Length of the flap should no more than twice the length, twice the width of the base, which means width of the base to be greater than length. I'll show you. Width should always be greater than the length. You can see the cursor, right?
Yeah. Yeah.
Okay. This width should always be greater than the length. See, width should always be greater than the length.
Greater than. Okay.
That's it. So x is equal to 2y. This x can be 2y. This is x and this is y. This x is equal to 2y. X is double the length.
Length.
Did you get it? X is equal to 2y. Just try to
So.
understand this formula. Yeah, okay.
Yeah.
Hello?
Hello. Yeah.
You have confusion.
Yeah. A bit of.
Yeah, I will tell you. So imagine this picture. This is the length. This y. This is the length. And this is the width.
Wait. Yeah.
Huh? In the principle, it is said that the length should never be twice greater than the width, which means just try to understand this formula. This is x and this is y. X is equal to 2y means
2y.
x can be 2y. X can be double the length. Width can be double the length. Length should not be more than width. Just try to by heart it. X is equal to 2y.
Yeah. Yeah.
Write it like this. Flat dimension x is equal to 2y. You got it, right? If you have any doubt, you just interrupt me and ask, okay? There's no problem for repeating. Okay, then next point is whenever a possible axial blood supply can be included in the flap, try to involve it so that the flap will get enough nutrients and food and the healing will be good. Okay, whenever like when you are
Oh,
doing a palatal flap, when you're incising a palatal flap, if you can place it near the palatine artery and all, after suturing, it will give all the nutrients and food to this flap and healing will be more easier. Okay, necrosis and all will
yeah.
not be present. So that will be a good healing process happening there.
Oh, oh,
Okay. And when you incise a flap and when you suture it, you always have to make sure that you should not stretch it, you should not twist it. If you stretch it, if you twist it, what happens? Oxygen supply decreases, necrosis occurs, and it will result in more and more damages. You get it right? These are the
oh,
four
yeah,
basic
yeah.
principles of a flap design.
Flap
We
this.
talked about
Oh,
the width, we spoke about the length, we spoke about the width. You just have to remember that formula, flap dimension x is equal to 2y. Just draw that picture. Then we spoke about the axial blood supply there. And next, the base of the flap should never be stretched or twisted. It can result in necrosis of the flap. You got it, right?
oh, yeah, yeah, yeah.
Now, when you go for an incision, when you go for a flap design or something like that, you have to always be careful that there is no flap dehiscence or flap separation occurring. Okay, when you it's
Oh,
prevented by approximating the edges over healthy bone, gently handling of the edges of the flap, and not placing flap under tension. If you place a flap under tension, it will get detached faster. There will be flap
oh,
separation. So always
oh,
gently handle the flap.
that,
Okay,
oh,
always try to approximate this flap over the healthy bone. That's why I'm repeating. You should place it over healthy bone.
healthy
Don't
bone.
go over.
Yeah.
Don't go over unhealthy bone. If you have an
Yeah.
unhealthy bone, just extend that flap to the healthy bone and suture it
Healthy
there.
bone.
Don't place it over
Oh,
unhealthy bone. Now,
unhealthy.
if
Oh,
you, if in some cases, if there was a mistake or a failure of the surgery, and if a separation or deviation occurs, what happens is there will be exposure of bone. If bone
oh,
exposure occurs, you can imagine what happens. The patient will be having severe pain. The patient will be
yeah.
having very much pain.
And
Bone loss can occur
pain.
because the bare bone is outside. So all the microorganisms will go and get othered there, and that can
Okay.
result in many other problems.
Yeah.
Okay, and scarring
Yeah.
after the healing will take months, and after this
Yeah.
healing, there will be increased scarring in that
For
area,
this.
aesthetically compromised. Okay,
Yeah.
so
Oh,
next is prevention of flap tearing. How can you prevent it? So that you have to use a very large
oh,
flap enough to avoid tearing or interrupting surgery. So,
oh,
as I have said in the first slide, give a long stroke. Give a long stroke
oh,
and
sure.
open
Oh,
as much as in flap as possible to
oh,
give an adequate access to that surgical area. Don't go
access.
for giving short strokes. If you give short strokes, it will result in many problems. You can damage the underlying structures. It can give a blunt kind of incision. It can result in more healing time. It can result in more bleeding. It can result in trauma to the tissues. It's all our
Oh,
problems with this short strokes and blunt strokes. So when you're giving, give a long stroke, give a large stroke, so you'll have a large flap, which will not interrupt the surgery. Okay, now vertical releasing incisions can also be placed on. If when you're placing it, what is vertical releasing incision? You give an incision downwards. Okay, when you give an incision downwards, you can actually open it in a triangular way. I will show you. There are pictures in the next slides. When you're giving a vertical releasing incision, you should always place that incision one tooth anterior to the surgical area. So you have a long flap. So you can see that area very clearly. When you give this incision, give it one tooth anterior. Okay, one tooth front, somewhat like 5 or
oh,
10
yeah.
centimeters front of the surgical area. So you will have a very big flap. You will have a very big area, so you can see and you can do the surgery smoothly. Do you get me?
Oh, yeah. Yeah. Yeah.
Now, when you give an incision, give the incision in a line angle, which is started in the line angle of the tooth or to the in the adjacent interdental papilla, and you just move it apically to the unattached gingiva. You'll start with the attached gingiva in near the line angle of the tooth or in the interdental papilla. You just move it apically, move it forward to the unattached gingiva. So if you do all these things, this will make sure that there is no flap tearing occurring there.
Hearing.
Okay.
Oh,
Now, after this, you have to make sure that you handle this tissue very carefully. So the soft tissues, you have to handle it very carefully. It can get torn. So you have to handle it carefully. Excessive pulling, crushing, extremes of temperature. What is this temperature increase occurs when you use burrs and all for bone cutting, and when you use bus for bone cutting, what happens? There will be a very big temperature because of this machine. All this can actually cause necrosis of the tissues, right? So you have to be very careful and handle the tissue very careful while doing the surgery. So the tissue tearing, the dislocation to be avoided. Then you have to use a tissue forceps so you can delicately hold the tissue, and you can have a very good access to that surgical area. Now, don't go for aggressive retraction of the tissue. If you go for aggressive retraction of the tissue will be in your hand, and the patient will be on the chair. That's what happened. You had to take it very carefully. The surgery in the department of surgery, you have to be very careful. Can really cause greater damage to the patient. Okay. Now, when you are using bud for bone removal, you have to be very careful by copious irrigation with a normal saline. When you are using a bud, you have to make sure that your assistant spray the saline, normal saline, to the bud tip. If she doesn't do that, this will result in necrosis of the bone, because bud is giving a lot of heat to the bone, and this heat will result in necrosis. So when you spray the saline to this bud tip, it will result in cooling down the bud tip, and this necrosis and all will not happen. So copious irrigation with normal saline is very important for a surgical procedure. Okay, now the soft tissues should be protected from this heat and direct trauma from the drilling equipment, as I said. Then the tissue should not be allowed to desiccate. Open wound should be moistened, then should be damped with a, it should be covered with a damp sponge, and only physiological substances should come in contact with the living tissue. Okay, only physiological substances. You don't put anything else, anything else over it. Like there are many cases where small instruments go inside the surgical area and all, right? Should not, you should be very careful while doing a surgery that only physiological substances should come in contact with the living tissue. If not, it will cause other damages. These are the points in tissue handling. Now we will come to hemostasis. Okay, you did all the surgery, and what you can see is a lot of blood in the patient's mouth. So you have to make sure that the blood flow should be stopped. If not, that will result in other medical condition to the patient. Okay, if there is excessive blood loss in a patient's mouth, what can happen? The patient's oxygen carrying capacity will get decreased, right? That's okay. That will lead to a very big medical condition, and the patient should be shifted to the medical colleges. So you have to be very careful about the bleeding of the patient. If there is a very uncontrolled bleeding, you have to take the hemostasis measures. Okay, and uncontrolled bleeding and also result in decreased vestibility, so that the pain assistant should be always helping us with the suction tips and all. And if there is a this hematoma formation is a very common thing. Do you know there's a nerve block which results in hematoma formation? PSA nerve block. PSA nerve block always results in hematoma formation. You know why? When we give this PSA nerve block, what happens is, if you don't go for a positive if you don't go for an aspiration and you directly give this LA to that PSA nerve block, the patient will show hematoma within 2 to 4 minutes. You have to, when you're giving a PSA nerve block, you always have to aspirate, and you have to see whether there is a positive aspiration. If there is a positive aspiration, you have to remove the needle as soon as possible, because this hematoma will take a long time to subside. Okay, this is the same thing in this. There can be presence of hematoma. This hematoma usually occurs because of pressure on bones, decreased vascularity, increased tension while suturing. You tense the flaps and sutures, can result in hematoma. Then some kind of bacteria or something present there, culture medium, then can lead to wound infection. Right. Now I'll tell you some means of promoting this wound hemostasis, how to close this. When you are doing a surgery and you see a lot of blood in patient's mouth, you have to close it before shifting him to a medical college or something like that. You have like 10 kilometers away from your dental clinic to the medical college. You can't tell the patient to go and visit it off. You have to do something, right? So these are some basic things that you have to know in a clinic. Okay, first of all, assisting the natural hemostatic mechanism, like you have to see where is this bleeding happening. Like there is a cut vessel cut artery or cut vein, you have to keep pressure with the help of a hemostat there, which is the first thing.
Okay.
Okay? If it is a very small vessel, you keep pressure like to 20 to 30 seconds, it will get subsided within 20 to 30 seconds. But if it is a very large vessel,
Okay.
you gave a cut to a very huge vessel, what you have to do is you have to give continuous pressure, continuous finger pressure or a hemostat pressure for 5 to 10 minutes. Okay,
Okay.
now
Okay.
it can be your assistant or you yourself performing the surgery. When you do a surgery, never try to wipe the area. If you wipe the area, what happens is your clot, which was which that it will reopen the vessels which are already plugged with the clotted blood. Only dab the area with sponge or cotton. Never wipe. It's a very important point. Never wipe any area. Just dab it. If you wipe, it will reopen the vessels which are already clotted. Okay. Now this is about electrocauterization. For this, most of the dental hospital has this electrocauterization measures available. And for this to be done, the patient should first be grounded. First be grounded to allow the current to enter the body. Otherwise, the patient will get shock and all. So first of all, make sure that the patient is grounded. Then this tip, the cautery tip or any metal instrument, the cautery tip contacts cannot touch the patient because this is current, this is electric current. The electric current can cause harm and damage to the patient. So you have to make sure that nothing happens to the patient. You just bring this cautery tip to this bleeding vessel or the bleeding area and just touch it. Okay, that's all what you need to do. Just touch that area with this cautery tip. And it will create a bond there. It will create a bond there, and that's it. Okay. Now removal of fluid and blood accumulated around blood vessel to be cauterized. Now you can go for tissue suture ligation. You can grab the vessel with the help of a hemostat. Then you can take a suture and just tie it. It's another method. Or if it is not available, you can go for some vasoconstrictor substances like epinephrine or anything like that, like or thrombin, collagen or anything like that. You can place it over this. Then also this bleeding will get stopped. These all are different types of methods available. Okay, we usually give pressure. First of all, we try to give pressure in all our clinics and hospital. We try to give pressure first. Give your finger pressure or hemostatic pressure. We try to give. If that doesn't happen, then we will go for electrocauterization. Okay, these are this utilization, all these things that happens in big hospitals around. We usually give finger pressures. Try to give finger pressure. It will get subsided. If not, we will go for an electrocauterization or anything like that. Okay. Now there is something called dead space. Dead space is an area which remains devoid tissue after closure of the wound. Now you did all the surgery, you close this area, this vacant space, and there is no this. What happens is after you send the patient home, what happens in home, the patient, that area will get filled with blood. Okay, there is no tissue inside. So this blood will flow and enter this vacant space, and this vacant space will now form a hematoma there. This hematoma is a potential site of infection. This is dead space. Dead space is an area which is devoid of tissue. This actually occurs after the surgery. Okay, you did the suture, you send patient home. In home, what happens is hematoma formation occurs and infections occurs. Okay, now when you do a surgery, when you do a suturing, you have to make sure that there should not be any vacant space or voids present. You have to suture the planes very tight, not tightly. You have to place it as it will close. It will close in a very good manner. Now, after that, place if a condition like this happens, then you have to place pressure dressing over this, and you have to compress it. Okay, compress it like for 12 to 18 hours. Place the packing into the void until now you have to open it. You have to place the packing inside the void until the void spots, until the bleeding spots. And this packing should always be impregnated with some kind of antibacterial infection because there will be infection. You have to give some kind of antibacterial medication to get rid of all these problems. Right? And still, it's not completely cured. What you have to do is you have to place a drain. It's a rubber drain. It's a suction drain. It's a kind of flexible Penrose drain. You have to place it so that the blood will ooze out through this suction drain. In addition to the pressure dressings, you can place a surgical drain. Okay, now this can also help in eliminating the dead space. This is what is called as dead space. This is a very important thing. You have to make, you have to study this. Can be asked in 4 mark question or like a short note question. It's an area which is devoid of tissues. Okay, this area comes in, area gets filled with blood. This causes hematoma. More infection chance will be there. So if a patient comes to you like this, what you had to do is you had to place pressure, then you had to take a gauze or something like that. You had to place some antibacterial medication over it. You had to place it inside this void. Then if in addition to this void, there is a lot of bleeding, what you had to do is you had to take a surgical drain, place it inside this, and it will get subsided too. Okay. So that's it all about dead space management. Next, we are going to the next topic, which is suturing. Suturing is also a usually asked question. Usually, the question asks like, I think it's suture needles and absorbable suture materials. These two are the major questions that ask for examinations. So suture needles, you have straight needles, you have curved needles. Okay, you can have straight needles like the needles that we have in our home. Then we have something called curved needles. Then we have tapered needles. You have cutting needles. This tapered needle is tapered needle is circular in cross section and tapers gradually to this point. This one, the A. See, it's having circular cross section and it tapers to the point. Okay, so this is mostly used for closing layers of muscles and fascias. Okay, we use cutting needle. This is cutting needle. It is having a triangular cross section. Points of triangle actually represents the blades 1, 2, and 3. Okay, this is usually used through the keratinized tissue. That we use this kind of needles. Get it right? Okay. Now we have straight needle, curved needle, as I have said. The straight needle we usually use for the circumzygomatic, circummandibular wires. These all are done for major fracture sections and all. I will speak about that in next classes. Okay, fractures and all, we use the straight needle like in circummandibular wires. Now we have curved needle that we use for skin surgeries, for mucous membrane surgery. That all we use curved needles. These are curvatures. You can see, right? See, 1/4 curvature, 3/8 curvature, 1/2 curvature, 5/8 curvature. Okay, we usually use 5/8 curvature or 1/2 curvature. These are commonly used in dentistry. Okay, now in cutting needles, we have two types of cutting. One is reverse cutting and other is conventional cutting. Conventional cutting, see, can you find any difference between these two pictures? Just have a look. Just have a look at these two sides. Here it is flat. Here it is. Here it is pointed, right?
Pointed.
This is flat. This is pointed. Now let's read this. Conventional cutting or cutting needle. One of the three edges along the internal curvature. One of the three cutting edges along internal curvature of the needle. This is what is known as the internal curvature, the internal portion. Or this one is the internal portion. And for a conventional cutting needle, edge is the curvature. Reverse cutting, with the internal curvature, you are having a flat surface. You get it? Reverse cutting needle, you have a flat internal surface, and the other kind of the conventional needle, you are having a cutting edge in the internal structure, internal curvature. That's the difference. And we use a half circle or 5/8 circle commonly in dentistry, and we use 3-0 black silk or polyglycolate commonly for suturing. Okay, now you have two types of needles available. One is a closed, one is the eyed or traumatic, and the other one is this bagged or atraumatic. We commonly use eyed one because this eyed can actually be reused. Okay, this is what is known as eyed. You can place a suture thread through it. You can tie the thread through it. So after each surgery, you can remove that suture. You can place this needle in the autoclave. You can sterilize it. You can reuse it. Okay. So when we use this eyed one, well, you have to make sure that this eye is having a larger diameter